Thank you. Well, I'd admit that I don't know as much about the AB 1400 as previous speakers. What I want to do is I want to celebrate our struggle in Chinatown on the Cathay Manor, how does it relate to, the healthcare for all. David said, currently I'm involved in that struggle, helping the Cathay Manor senior citizen residents to improve their living conditions. So I guess many of you have heard about the struggle, and I think that some of you have come out to support. And also probably have heard about the 16 criminal counts that were filed against the owner of Cathay Manor, called the CCOA Housing Corporation, and its president, Don Toy. Usually you don't hear anything about criminal charges against slumlords, but this is a rare incident where the city attorney actually did. As David said, this is a 16-story building, 270 units with about 300 seniors. Most of them are 70 years or older. But there are only 2 elevators serve this building. And in August and September, both of them went out of service for 22 days straight. And unfortunately, in October, November of this year, again, both of them went out of service for 23 days. So what do you expect the seniors to do, A lot of them handicapped. This is a 16-story building. So they had to climb up and down the stairs to go to their apartment or go do shopping. But the worst thing is that besides the elevators or our order, the lights in the stairs were burned out. It's been burned out probably for a long time, So it's just showing the conditions that was really bad. And we always ask, how many Dawn toys do we need to change a light bulb? I mean, it's a pretty simple thing, change the damn light bulb. That'd be better, but he is so neglectful, he's so abuseful of the seniors, he didn't do a thing. He didn't tell the seniors why the elevators are broken. In fact, he was told 2-3 years ago, these old elevators, you won't get the parts anymore. But he didn't do anything. So he just made the seniors suffer. But anyway, the reason I talk about that is that it's a big case. There are so many TV coverage, so many newspaper coverage. And one day we were out there, interviewed by Channel 5. And then this lady, Manor speaking lady came in. I got back from shopping. He saw us out there. So he wanted to speak to the TV channel too. Then he lifted up her pants, and showing all these salampas, patches all over her legs. Because she had climbed up and down, she lived on the 13th floor. So, and that made terrible. And then I hurt the shoulder too, because I guess once you hurt one area, you hurt the other area. So she was so upset, all she could do was just cry. I'm telling about her story is that besides her suffering, being a caretaker of her husband, which has cancer, is lying in bed all day long. So it's just very tough for her. So all she can do was cry during the TV interview. That made me think, what can AB 1400 do to help this woman? First of all, mental health is very important. She really suffers a lot of pain mentally. That can be helpful. And then for her husband, we have cancer in bed all day long. That can be very helpful, if you get good quality health care. And then the other thing is that for seniors, even like me, long-term care is very important. And free long-term care is very important. Even I don't get that, you know. The insurance you buy is huge. So that would be one advantage for her. But if she doesn't want institutional care, she can have in-home care. I think even better. Even to me, it's better. There's a family there all the time. So I think that's better. But one thing that I want to stress is that the whole idea of bicultural bilingual care. This is very important. I think previous speaker from Thai CDC talked about that. But I want to give a personal example. You know, a few years back, my mom fell down, broke her lip, and then we had to settle in a assisted living place in Alhambra. But then she hated there, so I moved her back into Chinatown. The reason is that they serve sandwiches at night, and on top of that, salad. But for my mom, she wanted a hot meal, cooked vegetables, and rice. Dinner without rice is not a dinner. So that is very important for her. So I think that this AB 1400 would help with these various areas that I mentioned. So fight for 1400, fight for bilingual, bicultural healthcare, and also rice for dinner also. You know, you can.